I thought it was an interesting session. It was very diverse. Dr. Bayat started off and talked about volatile compounds that come out of wounds. It turns out all bacteria have their unique signature of, unfortunately, bad smells, but ways that I think in the future might be an exciting way to detect what bacteria are in a wound very quickly. And it's a very interesting, novel area of research. As he pointed out, a bloodhound can, or a wolf can detect another wolf 2 miles away, which gives you an idea of what infinitesimally small amounts of a molecule of a volatile organic compound, as he calls them, are necessary. And I thought this is work for the future, but I think really has exciting potential in the future of wound care. Then we heard a couple of very nice talks about I guess the epidemiology of both leg ulcers and pressure sores, and I think the message certainly that comes through loud and clear are these are problems of great economic significance, as many as 2 or 3% of the population, and there I think is still in terms of controlling costs and improving care. The interesting things that are patients who are hospitalized are very expensive, and so really the future is in prevention. Then we heard a very nice talk from a Spanish surgeon on diabetic ulcers, and again I thought that one of the most interesting points that he pointed out is the issue of patient compliance with offloading in terms of pressure, and also the really very high incidences. In other words, almost all diabetic foot ulcers are in patients that have lost sensation, and so they tend not to protect their foot. And if you're going to get them to heal, you need them to avoid keeping pressure, and yet they still need to be ambulatory. And there are some new portable devices. It turns out that many patients are not compliant, many physicians are not compliant. And I think in all three of those talks on the major chronic wounds, we got the message that there still is a great deal of education among physicians as well as patients to get optimal care. I gave a talk on the importance of tension or mechanical receptors in producing scars, and both surgical techniques and non-surgical techniques to compress a wound or put pressure on a wound to modify in a beneficial way the scar. So I thought it was a very diverse panel with speakers from Spain, Portugal, Germany, England, United States, and I really thought it was a very high quality. I think the talk that made the most interest to me, outside of my own, of course, was the talk on diabetic foot ulcers, and really the concept that a great deal of these ulcers, perhaps many more than are recognized, have blood supply issues in addition to loss of sensation, and that the treatment paradigms, the treatment protocols really have been under the assumption that the blood supply issues are not so important. And so I think, to me, that if that idea can be embraced, it can really change the course of care of diabetes. I think the second is sort of something for the future, which is this idea of compounds that are volatile organic compounds that are produced by wounds. And it's intriguing. I think I suspect it's several years off, but it would be really nice if you could a patient could walk into your office and you could, within an hour or two have a profile of what bacteria are in the wound, which would then direct care. So I think those were both really exciting and interesting. I think that just to highlight the issues that I think are common in both leg ulcers and diabetic foot ulcers, that the treatment as it's currently being done in Europe and the United States, there are many deficiencies, and that care improves when education improves for the healthcare practitioner. So I think a meeting like this, getting a clear, kind of clinically relevant concepts presented, I think will raise the level of care, absolutely.